So good morning, everyone. Welcome to this first meeting of the Health Select Committee for the new Wiltshire Council. The first item on the agenda is to elect a chair for this year. Can I call for nominations, please?
May I nominate Jane Davis?
Do I have...
Do I see?
I'll second that.
Hang on. Are there any other nominations? And then, so I do declare that Councillor Jane Davis is chairman for this year. Thank you. If you'd like to move up.
Chairman, I wonder if you could possibly give a view as to why you should be chairman. Just explain to the gathered minions here to explain why you are the absolute perfect choice.
Well, thank you very much, Chuck, for calling me the perfect choice. There will always be a range of choices, and I know there are a number of people in this room who are keen to do this role and have expertise and knowledge which would be very relevant. So, you know, I'm looking forward to hearing from those people, and, you know, their voices are very important. Secondly, I would never call you minions. You know, you are the most important people in the room. The job of the chair is to facilitate your voices being heard. The reason I was keen to become chair of Health Select is I think it is the most interesting and most impactful area of the council. You have an opportunity through scrutiny of health to affect what happens to 500,000, you know, 500,000 people. You are working in the area of the council which, as previously cabinet member for adult social care, I was most enthusiastic about and ambitious for the people of Wiltshire. Those 9,000 people, make no mistake, they are the most vulnerable people in Wiltshire. And the quality of their care they get is really important. But also I was very proud of the way that Wiltshire addresses these things because we were balancing our budget. Chuck, you mentioned 50% when the last scrutiny exercise was done. Our costs are under 40% for adult social care. That budget is the crucial budget of the council. Without running it properly, then there will be no nice to haves, no extras. The preventative work will disappear. And it's a budget that very quickly can spiral out of control, but it doesn't. And there is most fantastically a synergy between doing it well and keeping your costs down. CQC assessed adult social care as good, and that's quite an achievement. Actually a very significant achievement. There's only one council that's an outstanding council and not that many who are good. It's important to get it right, and our scrutiny will be involved, you know, in achieving that. We'll also be looking at public health. And, you know, again, that's something that's impactful. Something that Wiltshire has been good at doing is that it has recognised the whole council responsibility to prevent, reduce and delay need. And they are doing smart, clever thinking things like working with leisure services so that our leisure centres support people who are vulnerable, potentially vulnerable, to prevent and delay need and thereby reduce costs to the council. I'm keen, I'm bright-eyed, I'm enthusiastic. I will drive you hard. But hopefully work with you all really closely. I want you to all really enjoy being on this committee and feel like you're adding value. And it's a fantastic time to be doing it because we've had a change of administration. I'm looking forward to hearing from our new cabinet members, particularly the new role for Claire Cape working with NHS interactions. I think that's potential to be really interesting and powerful. So we'll hear from you soon, but hopefully that's a brief overview. I do have a real special interest and passion for adults of working age with disabilities. I think we've done a lot of work improving special schools and education, but what happens to those people when they leave school? We have far too many people sitting on sofas, not living their best lives, and we have some fantastic work going on. I see Caroline Finch is here from Wiltshire Centre for Independent Living. It's the most fantastic organisation, and they are working more closely with adult social care through the Pioneers. But that's an area that's very expensive has potential to be impactful, but if it's not done well, spends a lot of money without achieving anything. So that's an area I will be focusing my interest on. I think that's probably enough for me, isn't it? Thank you. Right, so my first job as chairman is the election of a vice chairman. Do we have any nominations? Councillor
Chair,
Price?
I would like to nominate Councillor Sam Blackwell.
Yeah. Are there any, do we have a seconder for Sam Blackwell?
I'll second that, please.
Thank you. Are there any other nominations? No? In that case, are you happy to accept the role, Sam? Okay, great. I therefore declare that Councillor Sam Blackwell is duly elected Vice Chairman. Does Sam come and sit up with us? Not today, but hopefully in the Kennet room, which we will return to because this space is awfully formal. I'd like you to be sitting up at the top of the table, please. Do we have apologies, substitutions and membership changes?
We have apologies from, sorry, I'm going to scroll down, from Councillor Trevor Carbin is on his way. He should be here about around 11 o'clock. Otherwise, we have a full house for members. And Emma Legg, who's Director of Adult Social Care, has given her apologies. Obviously, there are no substitutions. And we have a whole new committee, apart from Councillor Dr. Monica Devendron.
Well, welcome back, Monica, and thank goodness there's one person still standing. Minutes of the previous meeting. Officers have advised that it's still procedurally correct to approve the minutes of the last meeting, even if current members were not present. So, and Monica, you weren't at the last meeting, were you? No, you'd given apologies. I saw that in the minutes. So I move that the committee approves the minutes of the 12th of March 2025. Can I have a seconder for that, please? Chuck Berry. Thank you. You're happy to approve the minutes? Yeah. Yeah, no abstentions? No objections? Okay, that's carried. Are there any declarations of disposable interests or dispensations as granted by the Standards Committee? No. Chair's announcements. It suggests I thank you for electing me as chairman. I think I've done that. And I think I've explained why I was keen to take up this responsibility. It is a good opportunity for the Cabinet members to introduce themselves. So shall we, ladies first? Gordon, shall we start with Claire?
Thank you very much, Chair. Councillor Claire Cape, Chippenham and Pewsham, and I'm the Cabinet member for Public Health and the coordination with the NHS. Thank you. I should just add to that I do have an extensive background in health. My very part-time job is with NHS England. I don't have any conflict of interest there. That's all been sorted out. So I'm very keen to be, I was previously a member of the Health Select Committee, and I'm very happy to be here today, and I will make every effort to come and join in as much as I'm allowed to with all the meetings. Thank you, Chair.
Good morning, everybody, and congratulations to your membership for the Health Select Committee. I absolutely endorse what Jane said. This is very, and Chuck actually, it's a very important committee, and I look forward to hearing your debates later on. But nevertheless, my name is Gordon King, and I'm the councillor for Westbury East and a cabinet member for Adult Social Care. I'm a former long-standing member of this committee and vice chair for as long as I can remember. Thank you.
Right, we're on to public participation, and members of the public are invited to put forward suggestions or ask questions of the committee. I don't think we've received any questions or statements from this meeting. Is
Not
that
this time, no.
Not this time, okay. But bear that in mind for the future. So on to developing the overview and scrutiny work programme. On page 3 of the agenda pack, we have a report setting out the topics recommended for inclusion in the new Health Select Committee work. Has everyone had an opportunity to look at this? Oh, welcome, Councillor Carbin. Hello. The report proposes the next steps for developing a comprehensive Health Select Committee work programme that reflects the priority of the Council, its members and Wiltshire residents. I will ask the report author, Julie Bealby, to introduce the report.
Thank you, Chair. This report sets out the topics that Health Select under the previous council felt deserved ongoing scrutiny in the new council, all included in Appendix A. But as this is your first meeting as a committee, I'm proposing that the list of topics in the report is simply received as a starting point for you to begin shaping your own Health Select Committee work programme over the coming months. The steps I've suggested in the report are as follows. So your discussion today, if you have any issues that you think are missing from the current plan, then you're welcome to put them forward straight away. If you want to put forward some topics outside the meeting, then you can contact either myself or the chair or vice chair, and we'd look at the options for scrutinising the subject. If you can, please do attend the planned event on the 1st of July, referred to in the report. So that's a scrutiny workshop. By convention, the chair and vice chair take a lead in developing the programme. So I'll be arranging meetings between them and their cabinet and director counterparts, where they can hear about the executive's plans and consider how these might be reflected in the Health Select's work programme. So with these steps taken, I would expect that we should be able to include on the next agenda an embryonic work programme with items scheduled in for the next few months, but there's still plenty of capacity during the year for other items to be added and plenty more work to do in scoping other areas of work. I would point out I've added Appendix B starting on page 33 of your pack. This is where I've penciled in some items that have been requested by officers or by the previous committee. I would like to emphasise that these are subject to your approval. So it's not a guarantee, it's to start the ball rolling, as it were. Finally, there are 3 rapid scrutinies mentioned in the report that you're being asked to approve. They're referred to in the report, and you'll find more details on page 27 of the pack. But I just thought I'd summarise what those rapid scrutinies were. So the first one is on urgent care reporting. So the demands on urgent care was a subject followed closely by the previous committee. The aim of the rapid scrutiny is to agree with the ICB the data that will be included in an annual report to the committee. So it's really there's obviously a vast amount of information that's collated, and would be trying to decide what would give you the clearest, as a committee, the clearest picture of what the service levels are like across the county. The other urgent rapid scrutiny was continuing healthcare funding eligibility. So the committee received reports on this funding stream, but wanted to have a better understanding of how social care and health services support individuals with ongoing health support needs. It's a complicated area, and I think so the reason was to understand how the eligibility is worked out. And finally, the mental health strategy, and I referred to it briefly. This was a joint rapid scrutiny with Children's Select to scrutinise the development of an all-age mental health strategy led by the ICB. So the initial part of the rapid scrutiny took place and that the strategy was reviewed. So this is the next stage to see how the strategy is being put into place, what's happening in practice, how is it being delivered. And that could be an item that you may want to bring to the main meeting. But at the moment it's proposed as a rapid scrutiny subject. So I'm happy to answer any questions.
Does anyone have any questions to bring forward at the moment? I mean, the key points for me when I read this report is that we're being asked to approve all the things in Appendix A as the basis for developing a forward work programme. It doesn't exclude other things being added. it doesn't mean that everything on this list will be included. I think the bulk of the work that should be done on the 1st of July and then moving forward. The 1st of July is a kind of less formal meeting. Well, there'll be lots of opportunity for discussion. I mean, I just quickly counted them. There are already 27 things in Appendix A, if not 30. Definitely the three that have been highlighted, the urgent care reporting, rapid scrutiny exercise is important, as is the continuing healthcare funding. They came twice to speak to this committee before, and I think the committee felt that there were still questions to be answered. So it would be good to be able to close that one down. And then the third one, obviously, is the mental health strategy, rapid scrutiny. And I think that was work that was initiated with Children's Select. Would we need to continue working with Children's Select too?
It would be helpful probably, but we'd need their agreement.
Okay, well, their meeting's next week, isn't it? Yes. Okay, so perhaps we can agree this now to proceed with Appendix A and perhaps take another action to ask Children's Select if they are prepared to work with us on the mental health strategy, rapid scrutiny exercise. Yes.
Again, I read those items, and again, it is quite extensive. There's one thing that always bugged me as chair in the past, and that was the machinations over the Better Care Fund, which is probably now the Integrated Care Board stuff. And just to help members, that's where you argue effectively with the NHS as to who spends what on whom and why. And that's a little bit difficult because clearly there's a lump of money. It used to be about 360 mil, and I'm not sure how much it is now. Probably the same. It's a question of whether the NHS picks up the 12 weeks once you come out of a procedure to look after that individual, or whether it gets slid across to the council. And I don't see that item on there, and that needs, in my view, constant verification and understanding around it, because I'd hate to see us, Wiltshire Council, being not looked after as well as perhaps they might be by challenging that split within the care fund money.
Yes, I mean, I would suggest that that's certainly partly covered through the continuing healthcare funding eligibility strategy, because the debate there is whether someone's needs are primarily healthcare, which the NHS will pay for, or whether it's social care. And we do know from reports that have previously been brought to the council that the spending in Wiltshire on continuing healthcare is less than in other places, for example. And one of the questions I would like to push further on is why is that the case? Because, you know, there is an ethical, moral thing here too, which is about if somebody's primary needs are health, they need the health specialists in. We provide excellent social care, we have reablement, but we don't cover health. We can't, and we can't be expected to. So there's a double-edged sword here about money, but also the rightness and appropriate treatment. Better healthcare, better care fund could come in. I'm looking at Emma. Do you want to tell us how much that is at the moment? It's Emma Townsend, who's Director of Adult Social Care at the moment. Could we have that figure for the minutes? Yeah, and perhaps a brief explanation, particularly for new members of the committee, about what that covers. Thank you. Are there any more questions? Yes, of course, Chris.
Thanks. I just want to clear something up. 1st of July, I'm going to give my apologies because I'll be flying out to the Amalfi Coast on that day for my wedding anniversary that week. Just drop that one in. But is this training and all that, face-to-face, is that for all backbenchers and all for scrutiny, or is it just specific for this committee? Reading it is for all committees. Yeah. So I think my previous 4 years with Vice Chair of ONS will help towards this. Yeah.
What we could do, though, is ask if we can have an hour tacked onto the end, or 45 minutes, if people feel that that is more relevant, to specifically talk about the work of this committee.
Yeah,
and
that,
go-
that's what I was picking up
Yes.
on what you're saying. That
Yes.
but, and could we have it recorded then, so I can, because I'm not going to be doing it on holiday.
Yeah, and that it could be recorded. Is it possible, Julie, to have that time within it?
To add on to the meeting.
Well, either to add on, and I'm looking at fellow councillors for the appetite for that. Councillor Hagan, yes. If we can't do it then, let's make another date that's appropriate for people.
Speaking very selfishly, I'm not here that week, and so I would love another date if we could actually but that's very selfish.
Can I have a show of hands to request that Julie sets up another meeting specifically for Health Select Committee members that looks at Appendix A in more detail?
Yes, but can we have it, it'll be after then our meeting on the 9th, won't it?
Yes, I mean,
Because I'm sorry, I'm being I'm back on the 8th, so I'm not going to be doing a lot between the 1st and the 8th of July, I'll be quite honest.
could, sort of end of July then maybe? Is that appropriate? Yeah, end of July for people? Yeah, okay. And we can do it on Teams if needs be.
Yeah, Chair, and perhaps what might be an idea, because it's important for all members to understand the issues around adult social care in particular, because that's at times when your residents will be having a catastrophic incident with their families and not know where to go next. And so to give you some idea as to what the criteria are, what the steps are, and how to deal with that would be really useful. Clearly, we have people in council that will be able to do that for you, but you can give them guidelines right at the beginning, because actually, until it happens to you, you have no idea.
Yes, absolutely. And just to kind of amplify on that point, we do have an advice and contact phone number, which is 0300 456 0111, is it? Yes. We'll put that in the minutes. There's also an out of hours contact thing. So if you do have a resident who phones you up and saying, we have a disaster, we have somebody who's having a mental health episode, or you know, something has happened, there are numbers on the council website, but let's bring them out in the minutes so that you can share that with your colleagues. So if there's no further comments, can I suggest we endorse the following proposals from the report? And that is, 1, to approve the legacy topics listed in Appendix A as a starting point for Health Select Committee's work programme 25 to 29. Council. 2, to note the next steps for developing Select Committee's work programme further as set out in the report, including discussion between the Select Committee chairs and vice chairs with the executive, council directors, local NHS bodies and wider stakeholders to gain a more informed understanding about key priorities and projects. 3, to approve the re-establishment of Health Select Committee's rapid scrutiny groups, if agreed by the Overview and Scrutiny Management Committee, with the appointment of rapid scrutiny members delegated to the Chair and Vice Chair of Health Select, following the invitation of expressions of interest from eligible members, and to approve the initial items requested from the committee's work programme in Appendix B. Do I have a proposer for that? Monica, I think, was first, and a seconder, Chris Williams. Do members agree? Yeah, yeah. Does anyone disagree? And no abstentions? Brilliant. Thank you very much. Right, we have next a cabinet member update. It's early days, isn't it? Are there things you would like to update us on?
You're quite right, Chair. It is very early days, so no update today.
Add something. So, Gordon, since you've been Vice Chair for as long as I can remember too, which is probably about the same length that you can remember, you'll be pretty well briefed up. So congratulations on the role. I know you'll be really good at it, and I hope to hear you waxing lyrical at our next meeting.
Thank you, Chuck.
Yes, similarly, I can't offer an update at the moment other than to say the learning curve is a steep one, as I'm sure colleagues appreciate. I'm meeting regularly with Kate Blackburn and her team to get fully up to speed. But I'm delighted to be here as a previous member, as I said, very interested in the value that this committee offers to the working of the council. Thank you.
Thank you very much. There are no urgent items. The date of the next meeting is the 9th of July 2025. And at that point, I think I can close the meeting, and thank you very much all for attending. Thank you.